the lobby of the NYU Langone Medical Center. This is Doctor Radio. This is Sirius XM Doctor Radio.
From the heart of the NYU Langone Medical Center, this is Healthy Aging with Dr. Michael Perskin.
Welcome to the Healthy Aging Show. This is Dr. Michael Perskin here on Sirius XM 81. We have a terrific program today. We're going to have Dr. Mark Supiano on for the last half hour, and he is a professor out at the University of Utah School of Medicine. And we're going to talk about how we think about controlling blood pressure in seniors. We're going to do some open phones and emails, and we're going to start off for this hour talking about hearing loss in the elderly, which can have a devastating impact on seniors' quality of life and their health. We'll talk about the importance of hearing screenings, treatments, and the modern options in hearing aids with Donna Ronan, the Doctor of Audiology and the Manager of Audiology Services at RiverSpring Hearing Care at the Hebrew Home at Riverdale. Donna, welcome.
Thank you very much.
Sure. Thanks for coming on and taking time out of your day. I would imagine that running an audiology department, right? That's you are the folks who assess people's hearing problems and help them with devices to help them hearing.
Right.
It's a busy thing at
right.
a skilled nursing facility.
So we are on the front line of that. We get all the phone calls. People call up and inquire first. You know, I think I might have a little bit of a problem. Maybe I should come in, to family members dragging their loved ones in. So it's a process. Right.
You know, it's one of those things that as a physician I can tell you, you know, everyone's interested in it. There's a lot of denial or, and some of that is on the patient side usually. Usually the family sort of acknowledges it. So it's actually unusual in that because sometimes the families are in denial about pieces of aging.
Right.
But on this one, the spouses, the children, the caretakers, they're all in agreement that something needs to be done. But the patient may not even be in denial, may even be the wrong word, but they just don't want anything done. And it seems so odd to me because I would relish improving my hearing.
Right. And actually denial is probably the correct word because there's a huge stigma to it still that people think, well, I can't hear as well, so, you know, I'm old, or I don't want to get those devices that cost so much money. And hearing actually gradually declines so slowly that people don't even realize that it's happening until they're really struggling to hear.
Well, that's why the questions I ask are, do you have trouble hearing on a cell phone particularly? That's the question I ask my patients as a screening question because you know, the speakers generally aren't that good, or they're a little better now, but
right.
And listening to television, I ask them if other people are complaining that they have it up too loud.
Those are key questions. I mean, I call my parents and, can you turn the TV down before I start talking, because it's so loud, and people will move it up to make themselves comfortable, not realizing that, oh my goodness, my neighbor can hear it.
Right, so that's a recognized phenomenon.
Right.
We'll talk a little bit about that, but why don't we kind of, for our listeners, talk about, so how common is it, either in the setting in which you work in a nursing home or in the country, as much as you know? I mean, it seems it's a pretty common condition, but what are the numbers?
I mean, 1 in 3 people over the age of 60 do present with a hearing loss. There's
a significant
hearing loss that's left untreated. It
right.
really takes people 7 to 10 years to really do anything about it. So the numbers are out there, and it's something that as people age, we're experiencing a lot more of this because people's communication needs are much more demanding than they have been. People are working longer. The need to really communicate and be involved is greater. So people are noticing more and more that the hearing loss is a problem.
Yeah, and folks have this issue, and I would tell you that my colleagues who do research in dementia and cognitive problems, they point out all the time that vision too is a problem.
Right.
Although people seem to like to get that fixed. Cataracts, people don't, they just go for the surgery and it's effective. But with hearing, folks don't, as we already mentioned. But if you think about it, your brain doesn't work so well if you can't hear and you don't see very well. So you're depriving it of these inputs, and that can make, actually what I tell my medical students and interns is, you have to sometimes recognize that there's hearing loss, because you're going to think that the patient has problems thinking when actually they're just not hearing you.
Correct. I mean, it's truly, people just not understanding that they're having a problem, and it's so unnoticeable to the patient that maybe they're just having trouble hearing in background noise at first. Maybe it's just when somebody's washing the dishes. And these little kind of key points kind of will point a person in the right direction to saying, I have a problem. But the real reason that people reject hearing aids in the end is that they've waited too long, so their clarity, like you said, their memory issues, isolation, they don't want to enjoy social situations anymore, so they stop going. And then all of a sudden, when they want to go to a family event, it's too difficult. And so they just, the memory's not made, they sit back and kind of watch everybody else have a great time.
Yeah. Now, when folks come into a place like the Hebrew Home, how are they checked? Does everyone get a hearing test, or just some people, or just if they screen positive in some way?
So my office works in two different ways. We see everybody who comes into the Hebrew Home for rehab. So everybody who comes in does get a screening, and it should be part of everyone's physical, to be honest. People need to understand and have a baseline of what's going on in their hearing.
And what's the screening that you do?
We actually do a full evaluation. We do a full evaluation in the office for everybody who comes in.
And is there a position of some national society on this, of audiologists, that every adult over age 65 should have an annual screening or a semi-annual? Or
there's no rule. It's
right.
just, it should be done. So it's a lot of times people will come in and say, well, like you said, my physician didn't recommend it. So, and hearing aids aren't as trendy as eyeglasses, so people are much more resistant to.
I think that is going to change, though. I think
so too.
I think it's a generational thing. I think younger people, they've actually done some damage, and maybe we can talk about that, from earphones.
Oh yeah.
Headphones, really loud. And then they're going to be excited to get their hearing back.
And actually, the new technology, the new advancements in technology are really exciting. It's something that you can Bluetooth directly into your iPhone. You can have control over your hearing aids yourself. There's a lot of fun gadgets.
So, like, if you're in a room where people are talking at you and you don't want to hear them, you could sort of turn it off from your iPhone.
You can,
and
look, everybody puts their iPhone on their table. It's not so obvious.
Yeah.
They're not reaching up, touching their ears, and it's actually really kind of cool advancements that are available.
Yeah, I think that's what's going to really turn the tide. So we are, Donna, going to ask our listeners to call in if they have questions or comments while we chat. We're talking with Donna Ronan, and she is the doctor of audiology and the manager of audiological services at RiverSpring Hearing Care at the Hebrew Home at Riverdale.